Assalamualaikum and salam UiTM di hatiku to all panels and our supervisor Dr. Zaini Zainal Abidin, also the fellow junior research. First of all, let me introduce our group member. My name is Rabiatul Adawiyah binti Zakaria and my partner.
Assalamualaikum, my name is Farah Amira binti Kamal Arifin.
Alright, we would like to present our Viva on the title on factors that influence acceptance behavior over Covid-19 vaccinations, a case study in UiTM Kota Kinabalu campus. Next, here is the content for our presentations. Without any delay, I will start with present the background of study. The COVID-19 cases in that have surged significantly since May 28, 2020 with over 30,000 deaths and more than 5 million persons affected in worldwide. So according to the study, required to offer crucial information to healthcare practitioners and government to aid and implementations for relevant laws and regulations. Besides, Malaysian government produced the program to aid in management of the COVID-19 pandemic in the country. By looking at the problem statement, there are three main problems here. First, factor can influence parents' vaccinations decision for the children based on current problem statement. Second, lack of awareness which may influence students on risk perception, vaccine uptake. The third one is widespread use of internet. It has become difficult to be trustworthy. Moving forward on research questions. The following research questions shows the data are useful to use were developed for a better understanding on factors that influence acceptance behavior over COVID-19 vaccinations. So the first question is about what is the level of acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu? The second one is what is the relationship between age factor and acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu? The third one, what is relationship between knowledge factor and acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu? Next, what is relationship between mass media influence and acceptance behavior over COVID-19 vaccination in UiTM Kota Kinabalu? And the last one is what is the most influential factor on acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu? Alright, next slide shows the research objective. So the following research question is the data to be useful which was done in UiTM Kota Kinabalu. First, we want to determine the level of acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu. To answer the second research question, we want to see the result, the following relationship between age factor and acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu. The third one is to investigate the relationship between the knowledge factor and acceptance behavior on vaccination in UiTM Kota Kinabalu. Next, to examine the relationship between mass media influence and acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu. The last one is to identify the most influential factor on acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu. And next is the conceptual framework. The figure shows the conceptual framework identifies that acceptance behavior is determined by three independent variables which are age factor, knowledge factor, and mass media influence. Thus, dependent variables are acceptance behavior will eventually influence the students for COVID-19 vaccines. Hence, there are relationships in between the dependent variables and independent variables. That's it for now. I will give my attention to Farah Amira. Thank you.
Assalamualaikum, my name is Farah Amira binti Kamal Arifin. I will continue with the research methodology in our study. In our research design, we are using a correlation research design. In this study, we are using a Google Form survey to spread the questionnaire through the WhatsApp, Facebook, and Instagram. For unit of analysis, the individual which refer to the bachelor student in UiTM Kota Kinabalu. For sample size, we are referring to the Sakaran and Bugis 2016. The table states that around 1,300 populations, the sample size is around 297. Therefore, our total of target population was 1,378 student bachelors consists of 6 programs such as ACC, AM, BA Economic, and BA Finance, AS, and HM. And our expectations of the sample size by referring Sakaran Bugis table was 297 respondents in UiTM Kota Kinabalu. Besides that, the sampling technique that we are using is simple random sampling, which means that anyone from Bachelor of UiTM Kota Kinabalu student can answer the questionnaire. Next, for our data measurements, for independent variable, the measurement we are using a nominal and Likert scale, which is from 1 to 5 points. For the data collection, in part A was the demographic profile, in part B for the acceptance behavior, part C was the age factor, part D for the knowledge factor, and the last is a part E for the mass media influence factor. We have been carried out by using a statistical package social science SPSS version 26 to test the objective which are correlations to identify the relationship between two variables IV and DV, the multiple regressions analysis by using a correlation strain based on the Guilford rules of thumb. Next, I will continue with the findings on our research. The first objective is about to determine the level of acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu. The finding shows that the level of acceptance behavior for vaccination among students in UiTM Kota Kinabalu is high. There are almost 99% of respondents are agree with the statement. Therefore, the hypothesis that we are significant and positive relationship between the level of acceptance behavior over COVID-19 is accepted. The first part of research questions on I am happy knowing that the number of people getting COVID-19 vaccination are increased have achieved the highest mean value of 4.45. Next, the medium mean that started in the question is, in my opinion, COVID-19 vaccine was rapidly developed and approved by government in Malaysia, have achieved median mean for 4.23. This shows that around 20% of respondents agree with the statement and 10% did not agree with the statement. Lastly, the question of COVID-19 vaccination is effective way to prevent and control the COVID-19. It was achieved that the lowest mean value of 4.17. This means that the vaccination strategy and the multiple regressions was performed to identify the influencing factor of vaccination acceptance for students at the highest institution. The second objective is about to investigate the relationship between the age factor and the acceptance behavior on vaccination in UiTM Kota Kinabalu. For the second objective research, the questionnaire is about I believe the vaccination for COVID-19 is a must for senior citizens, which are located and achieve the highest mean value of 4.39. The vaccine distribution strategy and the target group phase 2 in April and August 2021, the government allocated 9.4 million people who are priority group 2 senior citizens who does age from 60 and over. The high-risk group, which is a chronic disease such as heart disease, obesity, diabetes, and the high blood pressure, and the people with a disability. Next, the questions on I believe that current type of vaccines can protect people against COVID-19 have achieved the median mean value of 4.26. This means that the student can get COVID-19 vaccine in the participant of high odds of the acceptance vaccinations, especially for university students, to increase their willingness to take a vaccine. Moreover, the questions on I believe that COVID-19 vaccination is better than natural immunity by our body, and the result shows that the lowest mean of 4.10. The third objective is about to see the result differing relationship between the knowledge factor and acceptance behavior on COVID-19 vaccination in UiTM Kota Kinabalu. The question on I know that symptoms of COVID-19 being fever, fatigue, dry cough, and myalgia have achieved the highest mean value of 4.49. Besides that, the medium mean that stated in the question is I believe that the lack of knowledge and information about COVID-19 vaccine prevent from the getting vaccinated. This question have achieved 4.20. This means that the student has a medium understanding about the informations of COVID-19 vaccinations that prevent from them to getting vaccinated. Lastly, the lowest mean that started in the question is I believe that adequate knowledge of COVID-19 vaccinations can lead to the positive attitude. This question have achieved 4.14, the lowest means of knowledge factor variables. It can be shown that the most of the students will not educate their knowledge of the COVID-19 vaccinations that can lead them to get a positive attitude. The fourth objective is about to examine the relationship between mass media influencer and acceptance behavior on the COVID-19 vaccinations in UiTM Kota Kinabalu. The questions on I believe that information regarding COVID-19 mass media have influence on people have achieved the highest mean value, which is the 4.28. Besides that, the medium means for the questions are I believe that the anti-vaxxer have spared the belief of through the media platform. From the questions have achieved 4.14 for the medium means on this factor. Lastly, the lowest means that indicate in the factor are I believe that people rely on the printed media such as newspaper, book and magazines are more informations about COVID-19 vaccinations were more precisely and clearer. From the questions have achieved 3.98 was the lowest mean on the factor of mass media influencer. It can be concluded that most students are rarely use their device such as laptop, handphone and any other gadgets compared to the printed media. The last objective is about to identify the most influential factor or acceptive behavior on COVID-19 vaccination in UiTM Kota Kinabalu. Among all the variables, age factor has the greatest t-value, which is 6.169 compared to the other variables, which are knowledge factor and the mass media influencer. It can be seen that all the variables has below that 0.05, which is 0.00 p-value. Overall, the most influential factor of COVID-19 vaccinations can get attention to get vaccinated for those age factor. I will continue with the recommendations on our study. The first recommendation is about the future public health strategy targeting factor help to increase the vaccine uptake. Willingness to receive the COVID-19 vaccine was effective by the public nations. If the real-world acceptance level is like a finding of the study, the Malaysia will be able to achieve the herd immunity through the COVID-19 vaccinations program. Second recommendation is about the one-size-fits-all on mass media influencer. Our findings suggest that, for example, that one-size-fits-all approach to mass media interventions represent at the best of party solution to increase the vaccination uptake and at the worst solutions that backfire amplify existing inequality. The third recommendation about the promoting more public health communication. By encouraging more people to vaccinate, the government has promoted the strategy to aim to speed up the campaign for Malaysia's citizens. The government has also included the private medical center and clinic in the nationwide immunizations campaign to help to speed up the rollout of vaccination program. Besides that, in promoting the public health about the COVID-19 vaccinations, the government can imply the mobile vaccination unit for the rural area to reach out the people who may not easy to access the vaccination clinic. The last recommendation in our study about the rewarding COVID-19 vaccine receipt. For example, like grocery coupon, free hand sanitizer, face mask, pamphlet on the advantage of vaccinations, purchase vouchers, stationery, or special product are example of the reward that be presented to the community. That's all from me, thank you. I will pass to the next presenter.
Research limitations. Limitations are flaws in study that might affect our findings and conclusions. There's some of limitations to keep in mind, and results should be interpreted with caution. First, limited inconvenience sample size. This is because the small samples are used for the study. The true value that we choose to measure is complicated. The study employs convenience samplings, and the nature of web-based online survey also limits the participant of those without internet access, also digital literacy. The second, level of self-selection bias. The use of 5-point Likert scale for response to survey question may have resulted in some form of response bias. Merging responses into 2 or 3 groups, which whenever is applicable, could have resulted in some of loose in statistical interpretations of findings or original scale. The third one is limited in quantitative study. The reason is there are no predefined alternatives. The interviewer will react for the questions more correctly and directly through the interview process. To conclude, based on our presentations today, we as a STEAM research able to recognize where the students throughout this research, age factor is the most of influential factor for acceptance behavior of COVID-19 vaccines. On the other hand, based on literature study, a conceptual framework was explained Also, with the link between these variables and acceptance behavior is also briefly investigated. Besides, our research questions that contribute among 297 respondents from the individual who live in Kota Kinabalu that focus on students as our respondents to answer these questions. And the result, we explain by using reliability tests, normality tests, and person correlation analysis based on SPSS. And the strength for this study can be an example for other research to gain new perspective on volunteer involvement in COVID-19 vaccination, as there are limited research, especially on this topic. So, that's all for our presentation today. Thank you so much for lending your ear.